Thank you, everybody, for coming back. So we're going to go ahead and get started with our core director's presentation. But first, Dr. Garamori will do the introduction.
Well, good morning. I am very pleased to introduce Dr. Harkness. Audrey is a psychologist and assistant professor in the School of Nursing and Health Studies. She specializes in HIV prevention, mental health, and population experiencing these related disparities. She has done several studies identifying implementation determinants for various interventions, such as PrEP, mental health treatment, rapid ART, and using systematic approaches for developing adjunctive interventions and implementation strategies to improve the reach, adoption, and implementation and maintenance of health intervention. She also taught a course in intervention development and adaptation, and she is a great director of our EIS core. Dr. Harkness' presentation is developing implementation strategies, implementation mapping. Welcome, Dr. Harkness.
Okay, thank you so much. So I'm going to be leveraging my experience teaching about intervention mapping for my public health class over the last few years to talk specifically about implementation mapping today. So one thing that I'm trying to do, I did this workshop to learn what intervention mapping was, and I felt it was a lot more accessible because they gave us all these helpful worksheets to kind of like figure out how it actually works. So I made our own worksheet for today. So you can either scan here, and you can put on your computer the worksheet if you want to work through it once we get to that point. I also have like half enough copies of the printed worksheet because I didn't want to waste too much paper. So I'm going to like pass these around, and you'll be pairing up. So if you do want to take one, just like take one less for your share. And so I'm going to pass these around. We're not going to start using them right now, but I know sometimes there's technology issues. So just go ahead and grab that because that's going to be useful as we go through. So just pass those around. Okay. Everyone have that? Anyone have trouble getting it? Cancel is still working? It said it was not available. Okay. Let's see. Steve, can you email Araceli and tell her that it's not available? We will make it publicly available momentarily. And then we'll come, I guess, back to this link. Nobody's able to access it? Okay, wonderful. That's why I had it at the beginning. Okay, so we'll come back to that. Steve, let me know when it's available. Okay. So what I'm going to be talking about today first is what is implementation mapping? Has anyone actually, before we start, has anyone actually used intervention mapping before? One. Has anyone used implementation mapping? Two. Okay, great, wonderful. Okay, so those who have used it, feel free to chime in with facts that I might be missing. And those who are new to it, it's a little bit dense. And so kind of similar to the disclaimer that Alex gave, like, I don't really think you're going to walk away today and be like, you know what, I'm an implementation mapper now. But I think you might be able to imagine yourself using this as a process and learn more with the resources that I'm going to provide. And for me, it's been very helpful to do like an intensive workshop, which I'll provide a link to, combined with just doing it a bunch and like learning by doing. So anyway, jumping ahead from the agenda. So what is implementation mapping? I'm going to go through the steps. I'm going to give you some examples of how I've applied some of those steps from a project that I worked on. I'm also going to give some practice opportunities with the worksheet that we're distributing now. I'm also going to talk about how to use implementation mapping or intervention mapping in grants, which I've done a number of times. That's worked out nicely, some resources, and some time for questions. So to begin, and I think probably everybody knows this, but just to get us all on the same page, So implementation mapping is a process for creating implementation strategies. So implementation strategies, just to make sure we're all on the same page, those are methods or techniques that are used to improve adoption, implementation, sustainment, or scale up of interventions or evidence-based interventions. They might be simple, like one discrete strategy. It might be a whole package of strategies, but that's the whole purpose of implementation mapping. So I think probably many of you have tried to develop implementation strategies and kind of come across, as I have, this question of like, okay, well, how do I actually like develop these? Where do I start? And so a lot of the time through, I don't know, academia and intervention science literature, there's been a lot of intention and systematic processes for developing interventions. But for whatever reason, implementation strategies often are not as systematic in terms of their development or kind of robust in terms of their rigorous development and refinement and things like that. So unfortunately, with implementation strategies, their selection sometimes almost seems a little bit random or haphazard. And there are problems with that, just like there are problems with doing that for interventions. So if you've done all this work to show that there's certain determinants that are linked to, for example, inequitable implementation outcomes, it would be really wise for your implementation strategy to specifically address those determinants, right? So if you're kind of using the more haphazard approach, you're not necessarily hitting the main determinants that are actually causing those inequities. Similarly, if you're not taking a systematic approach, you don't necessarily know if your strategy is actually affecting the things that are getting in the way of any desired implementation outcome. And then another issue, and this is actually not comprehensive, is if the strategy doesn't work, we don't even really know why. Was it because it wasn't affecting what it was supposed to affect? Was it because it just didn't work and it was actually hitting those determinants, but it wasn't the right, change strategy? So there's a lot of reasons to be very intentional in building and selecting your implementation strategies, which unfortunately hasn't always been how people have done this work. So what instead we want to do is make sure that our strategies are addressing the specific determinants, the barriers or the facilitators, usually the barriers, but also leveraging facilitators to the implementation outcome that you are trying to achieve. So if you're trying to achieve the outcome of like an organization adopting an EBI, you want to target those determinants using that very nice CFR 2.0 framework or the health equity implementation framework. So those determinants you've identified through that framework, you want to focus on those when you're building your implementation strategy. You also want to make sure that your strategies have clear goals or outcomes that they're trying to achieve. So just like an intervention, we want to know, what are we trying to get to, right? Not just a shiny package of strategies that looks cool and interesting. And I love that Swiss Army knife that Alex showed. Like, that's not what we're going for. It's not just something interesting. The whole point is that we want to get somewhere, right? And so we need to know where we're trying to get with this strategy before we even decide what the strategy is going to look like. So implementation mapping is actually based on intervention mapping, which was developed first. And actually, that's what I'm more familiar with from my course that I taught for a while. And so intervention mapping, which we won't super go into, but just very briefly, that's a 6-step process for planning health promotion programs. And that's depicted here on this slide. And I'm going to give some resources for this process as well. And they're very closely linked, and I'll show you how. But essentially in intervention mapping, you go through like what's causing the problem, what needs to change, what are some evidence-based or theory-based ways to achieve that change, what's the program going to look like, how do we implement the program, and did it work? Sounds pretty simple, but it's a lot to actually go through. Maria Fernandez, Dr. Fernandez, noticed with the emergence of increased implementation research that there was a need to further explicate in intervention mapping step 5. So step 5 of intervention mapping is implementation mapping. So that's like a spoiler, right? So actually, all that implementation mapping is just pulling out step 5 from intervention mapping and really going through that more systematically. So in intervention mapping, you start with nothing. You don't have an intervention. So you're developing your intervention, but as you're developing your intervention, once you get to step 5, you're also developing your implementation plan and your strategies, right? In contrast, in implementation mapping, you already have an intervention. You know what it is. Maybe it's PrEP, maybe it's CBT, maybe it's I don't know, rapid treatment, whatever. It's something you already have well defined. So you don't need to go through all the steps of intervention mapping, but what you might need is strategies for getting that EBI implemented. So instead, you're just going to go through that step 5, which is really implementation mapping, with the EBI being that thing that you already have in mind. Does that make sense to everybody? Okay, cool. So instead, what we're going to focus on today is implementation mapping, but there's many reasons why you all might want to familiarize yourselves also in the spirit of implementation science training with intervention mapping, which I'll go back to later. So I think I already said this. Yeah, so if you already have a thing that's ready to be implemented, that's when you use implementation mapping. If you don't have a thing, then you go back to intervention mapping. Okay, so we're gonna go on then. It is working? Perfect timing. Okay, so then actually, I'm gonna just, oh, how do I go back in my slides here? There's a keyboard. Okay, we're gonna very quickly, sorry. Oh, there it is. Okay, everybody rescan. Thank you. And if you're using the paper copy, you don't have to, but if you'd rather have the electronic, that's fine. Whoever finds it successfully first. Hansel's saying no. Okay, sorry about that. So this link is not useful. So go instead to wherever there's a main box folder that RSLE sent to everyone with all the slides. So go to that instead, and the worksheet is there, and it's called, Lacey, EIS Workshop Activity. So you can find it there. Everyone got that? Under Documents for Interactive Sessions, EIS Activity, everyone's got it. Great. Okay, good problem solving. Okay, so, all right, so what we're going to do now is we're going to go step by step through each of the implementation mapping steps, and feel free to slow me down. It's a little dense. So if there's anything that is confusing, we can pause. Also, like, don't put pressure on yourself to get every last detail of this like ironed out in your mind. I think it's okay if it's a little bit fuzzy, but just try to think through like simple examples just to try to orient yourself to the concepts. And maybe it's just me that finds it a little bit dense. Maybe everyone else will find it really straightforward. Okay, so task 1 of implementation mapping is to conduct an implementation needs assessment. So the first part of this task is you're going to build a planning team. And so what I really like about both intervention and implementation mapping is that I think it's really baked into the process that you as a researcher should not be doing this alone, that you need a planning team, including people who are researchers for sure, but also lots of people who are ultimately going to be responsible for implementing the EBI within the intended setting at multiple levels too. So you want people on your planning team who are decision makers at implementing organizations, people who ultimately can decide whether they're going to implement or not. You also want the people who are intervention deliverers involved, so the ones who are actually going to have to be like, okay, here's how we do it, and walk patients through the process. And there's even multiple levels of that too. So there might be clinical supervisors, people who are more like direct providers, administrative staff. There's lots of people involved in delivering an EBI. So you want to have a nice, a team that really reflects that. And you can also have intervention recipients involved in even implementation mapping, because ultimately they're the ones who are going to be on the receiving end of these processes that are being implemented. And I think that also is an important consideration for equity in terms of like who gets to make decisions about how interventions are delivered. Okay, and so the benefits of including an building an inclusive and intentional planning team from early on. So you also really don't want to be doing this like at the later end of things. And that's why it's in step 1, is that ultimately, if you have this kind of team, you're going to come up with strategies that actually could work in the actual setting, right? Like I do not know. I don't work in a clinical setting right now. So I really couldn't know like what are the day-to-day challenges that folks are dealing with when they're trying to roll out a program. I have ideas, but I'm probably wrong. Um, you also are more likely to come up with strategies that are appropriate for the population being served, which again is an important equity consideration. And also, you're more likely to come up with strategies that could help in the long term. So not just like if you're doing this for a research study, maybe you know you want not maybe you definitely want to come up with something that works even after the research study is over. So it's more likely that you're going to be coming up with things that could work long term. Okay, so once you have your planning team together, your planning team is like involved throughout. So just everything we say from now on, this is like the planning team, not you as an individual necessarily. Um, so next, what your planning team is going to do is identify implementation determinants. So what Borsika went over yesterday in terms of those frameworks and things that can help to guide implementation research, those determinants frameworks, those are going to come in handy right here at this point. So your key questions here are what is or might impede implementation of this EBI in this setting? And also what might or could or does impede equitable implementation in particular. And it's important for you to define that for yourself as well, and maybe among your planning team. And then also, what are some facilitators of implementation in general or equitable implementation in particular? So I really like the CFR 2.0. I like to use, there's a rapid analysis approach for the CFR 2.0 that I've used and really liked. And that's a way of like very quickly gathering data and analyzing it to figure out which CFR determinants are most important in affecting an implementation outcome. So I've also used the health equity implementation framework, which is another useful one for identifying determinants. So you're going to use one of those to kind of systematically, it depends how, much time you have to work with. You can do this like highly systematically among your team and actually like do interviews, do focus groups, talk to people, maybe do a survey. You could also among your team, possibly you have the knowledge that you need. And these could be like tools to kind of have a series of conversations among your team more informally. So there's different ways that you could actually do this. And the nice thing about implementation mapping is that I think you can kind of spend as long or as little time as you have. So if you want to do it in a way that's really kind of like, each step is almost like not that this is the bar for rigor, but that is a published paper in itself. You could do that, but you could also be much more pragmatic and kind of swiftly move through these stages. But you want to make sure you're including your planning team in that process if you do that. So by the end of task 1, what you will have is a planning team that's inclusive and intentional, and you'll know what determinants you need to address with your strategy or your package of strategies. So I'm going to give an example now of how I've done this. And so this was actually an Ending the HIV Epidemic supplement with Alan Rodriguez, who is the PI. And what we were trying to do in this project was identify determinants of rapid ART implementation in South Florida. And so on our planning team, we had researchers at including infectious disease physician researchers, implementation science researchers, Florida Department of Health as sort of like almost a sort of an external policy almost leader, and high-level leaders at HIV clinics, frontline providers at HIV clinics, and then also people living with HIV who received standard or rapid HIV treatment from local clinics. So what we did in this particular case, and this was really like the project, was we did interviews and focus groups, and we identified using the CFR qualitatively what were some of the barriers and facilitators of rapid ART implementation at these local clinics in South Florida. And if you want to check these out, like the findings, feel free. This is the link here. Well, that's the title. Actually, it's not a link. And the point, I guess, right now is not necessarily what we found, but that was our very first step, right? So once we know those determinants, that's our first step toward actually then figuring out, okay, what are our strategies going to look like to maybe not always, like in some cases, these clinics were already implementing, but perhaps suboptimally implementing in some cases. So it's not always just like for starting implementation altogether, but it can also be for improving implementation. So that was our first step. And we did this in a very robust way. So like we really took our time, and this took almost a year to kind of compile all of this together. Okay. Oh, goodness. Okay. So what I'm going to do is I'm going to pause us here, and I think what we should do is take out that worksheet. And I want to try and kind of, as we're going through these steps, to just pause and in a very simple and brief way, try to follow along in either a hypothetical example, so you can make something up, or maybe you have a real EBI that you're thinking about implementing, and you have a context in mind or a study you're thinking about. So what I'm hoping is we can like pair people up, and well, you can self-pair, and or maybe groups of 3. And what I'd like you to do is just the first, oh, and I don't have my own copy now, so I'm going to look at on with Connell. Okay, so if you can just kind of get started with so before you start, identify in your pair, what is the EBI that you're trying to implement? And then what is the setting or type of setting that you'd like to implement the EBI? And don't feel like you need to be comprehensive, but for me, this was really helpful as I was learning these concepts. So just jot down a couple of people who should be on your planning team, and then identify a couple of potential barriers or facilitators, maybe based on your knowledge or just your best guess. This is not how this would work in real world, obviously, implementation mapping, but just to kind of start you thinking about like, okay, how can I actually use this process? And so I've in number 4 on the worksheet, I've organized that within the CFR, but you can use the worksheet however you would like. So let's just in groups, like take like 5 minutes and try to work through in a very expedited and brief way the before you start section and the implementation mapping task 1 section. Okay, so we're just going to take 5 minutes, and in pairs, let's just do that. And then we're going to proceed to task 2.
Like if you were gonna follow, I think that's like a standard. First. Yeah, we did like guided stuff like. So that's a huge enabling. If you want to have.
Okay, so that's a little bit more than 5 minutes. So I'm gonna bring us back. And hopefully people got through at least a little bit of that part. Okay, I'm seeing nods, great. And the good news is task 2 is iterative with task 1. So when we go to practice task 2, if you still have more for task 1, that's no problem at all. Okay, so we're gonna go on to task 2 and we're gonna keep bouncing back and forth. So keep your mind mulling over the things you were just looking at. So in task 2, things start to get a little more dense. So we're gonna kind of go through this slowly and we're gonna practice. So here what we're trying to do in task 2, we're trying to identify outcomes, and our outcomes are adoption or implementation outcomes that we want our implementers to achieve. And then we're going to break down those outcomes into what implementation mapping calls performance objectives. And then we're going to look at determinants and change objectives. So I'm going to break all of that down in a second. It sounds like a lot, and it kind of is, but we're going to work through it. Okay, so let's just start with the adoption and implementation outcomes. So the first thing you need to figure out is, okay, for each person or role that's going to be involved in implementation of this EBI, what are the adoption or implementation outcomes that the planning team wants that person to achieve? So just to give a basic example, maybe you have patient navigators, that maybe that's one of the roles of somebody who's going to be involved in this EBI implementation. And you want them, the outcome, the implementation outcome you want to achieve for them is that they will follow the prep navigation protocol to help patients start prep. So that's your implementation outcome, right? So that's just one example. But it could really, and it should be that probably because implementation is complex, there's usually lots more than just one person involved, right? So you might also have roles at multiple levels. So you might have like clinic managers will, clinic directors will decide to adopt, or administrative staff will. So there's all kinds of different people who need to achieve a different type of adoption of the EBI, an outcome where they'll adopt the EBI or they'll implement the EBI or even maintain the EBI. That could also be a different way of looking at this. So the very first step, and this is actually the first step of task 2, is pretty straightforward. You usually know this because this is probably where the whole project came from, but you're just defining it in a specific way. So that's actually pretty straightforward. Okay, so next what you're going to do is for each of those roles, you're going to break down the implementation outcome or the adoption outcome into performance objectives. So the key question for breaking this down is what does the implementer need to do to achieve their overall implementation outcome? Okay. So I'm going to give you, actually, first I'm just going to describe it. So it's really behavioral. So if you think about like, okay, my goal is to do this presentation for today, right? This is for any goal. You're just breaking it down into smaller behavioral steps. Okay, so I had to plan the slides. Okay, so I had to like make sure I got here on time. Okay, I also had to, and that's what a performance objective is. You're just breaking it down into behavioral components so that then you can kind of be a little bit more targeted in figuring out what your strategies are going to be. Okay, so this example, as a sad side story, I was invited to submit these all as supplemental tables for that publication, but then the reviewer said that they were a distraction. So we didn't end up being able to. So anyway, I'm really glad they're seeing the light of day with this presentation. Okay, so I created all these supplemental tables of our implementation outcomes and performance objectives and things like that. So I'm hoping that they can benefit all of you. So in our case, we were trying to implement rapid treatment. And so you can see that we have 3 different roles who are listed here. So we want clinic leadership to do something, we want administrative staff to do something, and we want medical providers to do something. And so in the second column, we have our implementation outcomes. So those are the overall thing that we want each of those roles to do. So just looking at that first example, so for the clinic leadership one, for clinics that have already adopted rapid treatment, the clinic leadership decides to set a goal of 50% increase in a 1-year period in the proportion of newly diagnosed individuals who receive rapid versus standard treatment. So that's like very specific, right? And it doesn't have to be as specific, but that's what our goal was that we decided on with our team. So then you break that down into your performance objectives. So, okay, first we want the leadership to agree to an increase of implementation of rapid treatment by 50%. 2, we want to have the leadership design a scale-up plan so that rapid treatment is gradually expanded within the clinic. So like 30% by this date, 40% by this date. We want to set up contracts and procure funding to cover the costs of expanding rapid treatment implementation. We want them to establish formal relationships between the clinic and outside organizations. So we're kind of breaking this down into behavioral steps that would actually, in aggregate, be the overall implementation outcome. So it sounds kind of like a lot, but it's actually, I think, very intuitive. So I can leave so all of these examples are in the slides, which are in the box folder. So if you want to refer to those when you're doing the practice exercises, you can. Okay, so now you have your implementation outcomes, your performance objectives. Now what you want to identify are what are some personal determinants for implementers. And what this means is really like, why would the implementer do or not do their performance objectives and ultimately achieve their implementation outcome? And these determinants might and probably will overlap with some of the determinants you identified in task 1. And that's why I said it's kind of iterative. So you might go back to task 1 and pull out some of the determinants you've identified. But in looking at this in more detail and like really examining each of those performance objectives, you might with your planning team identify additional personal determinants that are also important. You can draw from theories behavior change theories. You can also draw from IS theories, like the CFIR, the Health Equity Implementation Framework, to identify some of those personal determinants. And I think a very good, simple example of this could be, self-efficacy could be a determinant, a personal determinant, why a PrEP navigator may or may not do the tasks involved in the PrEP navigation protocol. So that's a simple example, okay? Everyone with me so far? Okay, great. All right. So here's where it really gets exciting and fun. So then you're going to take your performance objectives and you're going to make a matrix. So you're going to have your performance objectives here and your determinants here, okay? And so you'll see that on, good thing I didn't include page numbers. Okay, in 7, okay, in your worksheet. So you'll see an example of what that matrix looks like. It's not filled in, but it's what you're going to fill in. And so basically you're going to have your, okay, what you're trying to achieve and things that may help or get in the way of achieving those things. And then you have some empty boxes in the middle. Those are your change objectives. So you're going to think about, okay, what would need to change related to this determinant for the person to achieve their performance objectives. So I'm going to show you what that looks like. So it sounds like a lot, but it's okay. So here's what I have here. So these were my performance objectives that I had broken down all across on the left-hand column there. And in my case, I identified with the team some determinants that might help or get in the way of achieving those. So knowledge and skills, resources, communication and networks, and other personal qualities of the implementer. So what I did was then you take the performance objective. So here's the performance objective. And this one is for the administrative staff, medical providers, pharmacy, and patient navigators. So their first performance objective was that they needed to complete training and education on rapid treatment implementation to reduce the complexity of the intervention for themselves. And so the determinant was knowledge and skills. So that might affect their completion of this. And so what we want to see change is that the role through doing this demonstrates their knowledge of the clinic's rapid treatment process and also demonstrates knowledge of what their own specific role is in implementation. Often you only need one change objective, but I guess I went overboard and I included 2. So they also could, to overcome this determinant, demonstrate skills in navigating patients through rapid treatment, evidenced by performing one's designated role in the process to link the person to treatment on the same day. So really what you're doing here, it's kind of like a preview of what the implementation strategies might look like. And this is about being creative and coming up with potential things that could change within the determinants to achieve these. Sometimes I think that people get a little overwhelmed in filling this out because they think, oh my gosh, I have to actually now come up with some kind of package of strategies that's going to do all of these things. And that's not actually necessarily the case. This is just your first step toward actually like pinning down what your strategy is. So you may have things on here that you're not actually going to do as part of your strategy package, but you're just kind of laying out options for yourself, basically. Does that make sense? Okay, perfect. So I think, yes, we are at practice time now. So I'm going to go back here. So what would be the most helpful? Do you want to see this as the example up on the screen or the other example? Everything is in box. I'll leave this because I think this is the more complicated one. And what I want you all to do is basically go back to the worksheet and you're going to take a look at task 2. So I would say take like a few minutes first and do number 5 under task 2. Try to come up with, does everyone see where that is? Okay, so number 5, just look for number 5.
Identify adoption implementation.
Yes, perfect, yes. So under number 5, thank you, Connell, you're going to identify your adoption and implementation outcomes, and then you're going to break those up into performance objectives. Don't feel like you need to be comprehensive here. I just want you to start practicing a little bit to kind of get a sense, like maybe just choose one role for right now so you don't overwhelm yourselves. But just choose one person who might be involved in this implementation effort. What is the outcome you would want to see for that one person? And then maybe just break that down into like 2 or 3 performance objectives. Don't go crazy, okay? So just kind of break that down a little bit. And once you've done that, you can move on to number 6. So what are some things that might help or get them in the way of that person doing those different performance objectives? And if you're feeling ambitious, you can also go on to number 7. But if you don't want to go on to there, that's okay. You could also do that on your own at another time. I know that it's starting to get a little bit like it's a lot. So let's go ahead. Let's take 7 minutes this time. This one's a little more complicated. And so we will go until about 11:28 on this one. And call me over if you need help, okay? Yes, I'm on my way. Okay. I'm gonna volunteer JD as well, who knows this process, as a helper.
Or is this actually? We don't necessarily need
Yeah, so it's not. It could be external as well. It could be like, basically there's like, there's not a policy. Some things are, that means that they can also be like, but it's easier to think of these as the levels, so just go with the rating. Okay. Do you guys need anything on them? Here it is. Ready.
Okay, I think we're gonna move to task 3 now. Hopefully everyone got to engage a little bit. Some are still engaging. That's great. All right, so we're gonna move to task 3 now. And I also just, if you're feeling at all overwhelmed, I'm also available for consultations. So sign up for a consultation. Okay. So we're gonna move to task 3 now. And this is where we're actually going to really start thinking a little bit more about what the actual strategies are going to be. So here what you're going to be doing is selecting what implementation mapping calls theoretical or evidence-based change methods, and then starting to design implementation strategies. Okay, so at this point, you know what your implementation outcomes you're trying to achieve are. And so what you're going to do is you're going to choose some theoretical or evidence-based methods for making those potential changes. There are many, many different change methods out there. And I think on a different slide, I have a couple of taxonomies that you can look at for some inspiration. Does anyone know the ERIC taxonomy of implementation strategies? I would think of those actually as an example of theoretical or evidence-based change methods. There's also more like from behavioral science taxonomies that are out there, which I'll link to as well. But examples of change methods that are more individual level could be like, I'm going to increase someone's knowledge. I'm going to change someone's attitudes. I'm going to build skills. Or you can also think at the organizational level or other levels too. Like I'm going to change the leadership in some way. I'm going to build some kind of infrastructure, right? So I think of change methods, theoretical and evidence-based change methods. These are things that have meaning, but also don't mean anything. So there are things that like, if I say, oh, I'm gonna do like a knowledge, I'm gonna increase people's knowledge. What am I gonna do? I don't know, right? That needs to be further operationalized, but you're gonna start at that kind of more theoretical level, right? And then you're gonna further operationalize that in the later part of this task. So you're just really thinking about, okay, my change objectives are identified from task 2. I know what I want to achieve. So what are some broad change methods that I could use to try to facilitate those outcomes that I'm trying to get to? And it is really important, especially thinking about equity, to be thinking multi-level. So not just what does one individual person in the system need to do, but also systemically what needs to change. And actually, you can even use implementation mapping to think about or develop like policy level implementation strategies, even if you wanted to. So you can think very big picture here. Whatever methods, though, for the change that you are selecting, you should have some reason to believe, either from theory or from published behavior change studies, that that change method would have some impact on the determinants that are impacting your performance outcomes, your performance objectives and your outcomes. So they shouldn't be random, they should be linked. So here are the links that I had just mentioned. So check those out. Those are in the slides if that's helpful. There's also an excellent intervention mapping textbook that I'll tell you more about at the end, and has this beautiful table that I use in my class that is very accessible of all kinds of different change methods. Okay, so as I said, once you have your change method, you do need to further operationalize it. I don't know if folks have used like the ERIC taxonomy, and some of those things, they really don't mean anything unless you further operationalize it. You need to make it make sense in your context. So this is the next part of this task. So once you have your change methods, your theoretical methods, you're going to operationalize what those things actually mean. So you're really kind of now specifying like, okay, this is the implementation strategy. And what's that going to look like in a way that fits the context, the population, the culture, right? So increasing knowledge is a theoretical method, but that could mean a 2-day training program that involves role play exercises and didactic content on PrEP navigation. That's one way to increase knowledge. Another way to do that is an informational handout on the importance of following PrEP, the protocol for PrEP navigators. Another way of increasing knowledge to people who speak different languages could be translating the protocol so it's available in Spanish and Haitian Creole, for example. So there's many different ways to apply any given theoretical change method. So you wanted, this is, I think, where you start to actually get a little bit creative. And so if you're more of a creative person, this is where implementation mapping gets more fun. So you're thinking about, okay, within this context, what's this going to look like? And I think that Alex's human-centered design talk also kind of interfaces nicely with this, because as you're operationalizing, you really want to be thinking about like, who is the community that you're trying to serve? Okay, so this is how I broke this down, and there's an example in your handout of how you can do this as well. So for me, these were the methods that I chose to facilitate the clinic leadership's implementation of rapid treatment. So I'm just going to go through the very top row. So the method I chose was at organizational commitment, which is basically just getting a formal commitment at the organizational level. And I chose this because I felt like it affected a number of the different determinants or change objectives. readiness for implementation, leadership engagement, agreeing to increase rapid treatment by 50%, designing a scale-up plan. And then I further operationalized it. In this case, it was kind of already a little bit more clear, but in some cases it's not as clear. So I further operationalized it as agree at a clinic leadership level on the adoption/implementation plans, including a scale-up plan for rapid treatment, and communicate this formally to all staff. So that's like much more specific than just make an organizational commitment. So for everything that you identify, you're going to kind of go through that process and think, okay, so what's the method and why am I choosing it? And then what would it actually look like in this particular context? And that is it for task 3. So it's a nice, friendly task, in my opinion. So let's oh, actually, do I have another? No. Okay, so let's pause there, I think for like 5 minutes or so. And I think we can just do another round of practice. This is, I think, our last round of practice we're going to do for today. And so try to come up with maybe like 1 or 2 methods. Think about what determinants they're linked to, and then further operationalize it more into a strategy. Okay, so let's take 5 minutes and we'll try that as our next step, and we'll come back a little bit after 11:40. Okay? And I'll be available for questions. Flag me if you need me. That would have been a good one. Much more.
Right, like when I think of they can be very generic, right? Like my implementation strategy is a financial, like I mean, like the explanation is the nitty gritty as to what you're trying to get at. Like it's flipped for me. That's when they're linked together. Right? It's very specific. Yeah, okay. I just wanted to make sure that I understood it. Okay.
Maybe like.
So the design, the second part of to be.
Outside of like, but I think it's so hard, right? Because like nobody's gonna like you know that they maybe so how and I think that would like
All right, in the spirit of time, we're going to keep moving, but I'm seeing people are coming up with strategies, which is really exciting. So I'm glad that this is, well, I'm assuming that this is helpful, and I'm glad at that assumption. Okay, so we're going to not do any more practice right now, but you have the rest of the tasks in this worksheet. So if you want to keep going on your own, you certainly can. But I'm just going to briefly describe the remaining tasks. The next task, once you've done this, and I saw a lot of people were really operationalizing their implementation strategies and seeing how they linked to the determinants. And that's exactly the goal of this whole process, is to not have haphazard selection of strategies, but to have them actually go back and be linked to what we're actually seeing as the problem that's interfering with implementation. So here in task 4, we get to be even more creative. So this is where you're producing implementation protocols and materials. So in task 3, you've started to operationalize the strategy, but in task 4, you're bringing it to life. One thing that implementation mappers do a lot of the time, they create these like design documents to kind of make sure that as they're designing, they're staying true to what they meant to create. So you can make design documents however you want to, but things that you might include in a design document, and this is particularly helpful if you're like sending it off to another like graphic design team or something like that. What's the purpose of this material? Who's the intended audience? What are you trying to change? What methods are you using? And also start drafting up some of the content. What words do you want to use? What images do you want to use? And so you're starting to like really bring it to life. So this group was talking about like doing, I think, like video workshops with people who inject drugs and maybe videos. I can't remember exactly. But in any case, you would start drafting up, okay, what's the structure of this? How's it going to look? And so whether that's technology, a handout, a protocol, whatever it is, it's all design, just like what Alex was saying earlier, right? So we have to make a plan for that design. So again, we don't want things to get haphazard in task 4. So it's about kind of creating linearity across this whole process. And then once you've actually created these things, you're going to do like pre-testing where you're going to show potential users of these materials, what you have created, within your planning team, but also then going outside of your planning team and, people who are new to all of this work that you've been doing, and try to kind of iterate based on that feedback to make sure that the final product that you have is really actually going to be useful. And then your very last step in implementation mapping is to evaluate implementation outcomes. And here I would basically defer back to what JD talked about yesterday in terms of the different types of hybrid studies. You could also do an implementation trial. But essentially you want to find out, is your implementation strategy effective? And to know that, you need to evaluate whether it achieves some intended implementation outcome. Also a plug, this was a topic covered in our recent gray areas paper that was published, is how do you know if an implementation strategy is effective, which is a different question than is your intervention effective. So that's really what task 5 is all about. And you're going to work with your planning team too to remind yourself about, okay, if you're going to measure implementation outcomes, what are the outcomes that are important to your team? And you can use mixed methods to evaluate some of these. So we can bring in Sarah's talk, right? So we can use rapid qualitative, we can use quantitative methods. Going back to Borsica's talk, those outcomes can be evaluated with existing evaluation frameworks and implementation science like RE-AIM, right? So implementation mapping brings so many pieces together, which I think makes it exciting. Okay, so that's all I'm going to say about the process of this. I also just want to say a little bit about how it's been really useful for me in terms of grant writing, and also just once I have the grant, like guiding me through the process. I find implementation mapping particularly useful to use when I'm submitting grants where I'm developing implementation strategies like an R34 and R21, the EHE supplements, which I guess are no longer a thing, but a K or an F, like those kinds of grants, I found it particularly useful. So for example, I had an EHE supplement where I was developing a strategy to address fragmented HIV services in South Florida. And so what I used in the grant was implementation mapping, both to guide myself to what I was doing, but also to guide the reviewers as to what I was doing. So if you look at my AIMS page for that grant, I said that implementation mapping is the process I'm using for all of my AIMS. And I described our planning team, right? That's task 1. And then for each AIM, I described how each AIM was completion of an intervention, an implementation mapping step. So I'm not going to go through this in too much detail, but you can see AIM 2. Oh, somehow I skipped step. Okay, well, anyway. And then ultimately what I said in the end is that this is going to set us up to do implementation mapping step 5. And I also really like this. I often will use a table like this to really visually show, like, what have we done? What is this grant going to accomplish? And what is it going to set us up to do in the next one? So actually this one, sorry, this is actually intervention mapping, but it's very similar. And so in my case, I was saying like, okay, my preliminary data is my first step. And then my aims are the second, third, fourth, and fifth step. And my implementation outcomes that I'm going to evaluate are my next grant, right? So then when it came time to write the next grant, I was able to refer back to it and say basically that the whole grant is implementation is step 5. And so here this is the same figure, but modified for my R34, where I said, this is what I'm doing, is this last step. And we're going to potentially need to go back and iterate as well, which is an important point about mapping as well. It looks linear, but you often have to bounce back and forth. Okay. And so then a few kind of frequently asked questions of me to myself, but maybe you have them as well. One common question, so in implementation mapping, they also have all these like logic models you can build and stuff like that. And so sometimes people wonder, do I still need to use the implementation research logic model? And I would say they serve different purposes. So I wouldn't think of them as like conflicting. And JD, maybe you can talk about it during have you already talked about your IRLM? Do you want to say a few words about that?
It's pretty, I mean, to be honest, it's basically that the IRLM is going to give you a much bigger picture of what's happening, and then implementation happening. Dig into very specific strategies that need the level of detail that IM is going to give you. So even though you might have 15 strategies in your IRLM, you may have to do implementation mapping for 2 or 3. But honestly, not necessary.
Yeah, yeah. So they're not redundant, if you're wondering about that. Okay. Next is, can I still use implementation mapping if I'm developing an intervention? And so I think we've gone over this, but if it's really that you don't even have a thing yet, you need to go back to intervention mapping. And I think this comes up too, and maybe as a separate, yes, okay. So this also comes up with adjunctive interventions, which I've struggled with for years. And now that I have a word for it, it's helped me. So adjunctive interventions, also JD wrote a paper about this that's very helpful. It's sort of that gray area between what's an intervention and what's a strategy. So adjunctive interventions are that gray area that are not directly responsible for health outcomes for an individual, but they're helping that individual engage in the clinical intervention. JD, fact check me if I'm getting this wrong. Help the individual engage in the intervention so that they maximally benefit, whereas the strategy is more organizational typically. So anyway, if you're developing an adjunctive intervention, my opinion, but I am wondering what you think, JD, I would use intervention mapping to develop the adjunctive intervention. And then your step 5 is to develop the implementation strategies that correspond to that. I'm getting a nod. Excellent. You heard it here first though. Okay. And so a couple of other tips, like Borsika said the other day with these, with any frameworks, and I think implementation mapping is totally different as a framework, but nonetheless, if you say you're using it, you kind of have to use it. So in my class, one of the assignments is that the students have to find an article that published intervention saying they used intervention mapping or implementation mapping. And my intention in assigning this was just that they would see how it's applied. But unfortunately, many of the papers that I received informed me that the paper didn't actually really talk about implementation or intervention mapping. So that's really kind of a missed opportunity for really, rigorously following this. And it makes it harder for readers to evaluate rigor as well. And then, as I said, IM is not necessarily linear. Iteration is very normal. Working with community partners, you're often going to come back. And also the context just changes sometimes, then you have to go back. And that's okay, and that's normal. These are a few resources. They'll be in the slides. This is the article that Dr. Fernandez wrote about implementation mapping. This is the most excellent textbook, most useful textbook I have ever read. And this is what I used in my class. It's very, very practical with tons of examples. And if you're at UM, it's free through the library. You can see the whole book. Interventionmapping.com has a bunch of resources. And then UT Health Houston, if you're excited about this and you really want to like learn how to do this and become someone who really like can offer this and do this, I would definitely do some of their workshops. I did one, it was like a winter session. It was a whole week. And each day we like really, the whole day was like one step, and it was really amazing and helpful. And they have one for intervention mapping and then one for implementation mapping. That's all I have. Thank you. I think we have time for a couple of questions, if there are any, but we've been engaged throughout, so maybe everyone's done.
Studies focus on or required to talk about
Yeah. Yes.
Won't this be applicable or translatable if you're doing like web development or app development for your intervention?
I think that it would be the same. So I think that if your intervention is an online or web-based, I would probably use intervention mapping if you're developing it. If it's already developed, then I would use implementation mapping. But I think the process is the same. The specifics are just going to look different because, and you may need to like draw on resources that are more specific for like e-health development, but the steps and like the way of thinking about it is really the same. It's really just a different platform. So I don't know, do others have experience otherwise? I'm curious. I know there's not a ton of people with experience. What do you think, JD?
I mean, digital health intervention. A lot of the strategy perspective is so different because there isn't a market per se. And especially, we actually talk sometimes. The other thing that's really hard is sometimes, you gotta think about like the infrastructure for hosting, the infrastructure for maintaining, people who do technical assistance. If you have like a manual or an FAQ page, like those are all implementation strategies. And sometimes those are like the research team is actually providing those. They're still strategies. So it's just like a different mindset that makes it like some of the examples and things that you'll see are just harder to apply to digital health because it's just such a different like implementation structure.
Yeah. Thank you. Good question. All right. Thanks so much, everyone. It's time for lunch. Okay. Is there anything else you need to do? Oh, actually, no, it's time for lunch and networking.
Yeah. So, thank you, Audrey. I'm gonna stop this recording.